Okay, let's go on to a kind of another myth. DHT, is it desired or considered a side effect?
Well. Okay, so DHT is quite misunderstood out there. I find that DHT is an interesting topic because of the misinformation that's there. So let's talk about normal ranges again. So the normal range for DHT is 30 to 85 nanograms per deciliter at LabCorp, for instance. All right. People need to understand that when you take exogenous testosterone, no matter what method you get, you're going to raise levels of testosterone's active metabolites, which are DHT and estradiol. Yes, the transdermal creams will raise DHT levels higher than injections because of the 5-alpha reductase in the skin. But we're going to talk about the fact that that has no clinical effect. All right. So when it comes to measuring levels of DHT, it's important to understand that the levels of DHT in response to testosterone therapy do not correlate with the levels found in androgen sensitive tissues like the prostate and skin, for instance. This is due to local regulatory mechanisms that tightly control intracellular androgen homeostasis. Intracellular concentrations of DHT are essentially independent of circulating levels of DHT. DHT works primarily in a paracrine fashion and is made in the target tissues. So even though you raise DHT with a transdermal delivery system, it has no effect on the intracellular levels. How do we know that? Well, we have studies where we gave men DHT for 2 years. We raised their levels to over 700, and there was no effect on intracellular DHT levels, nor was there an increase in acne or male pattern hair loss, believe it or not, in that. So what happens, it's really your free testosterone levels that enters the cell in androgen-sensitive tissue, is converted into DHT, and then exerts its response. So that's kind of DHT. So what we're measuring in the serum is no reflection of what's happening in the tissues. So I guess guys are out there worried about hair loss. I guess because we all hear about hair loss. Let's talk about hair loss. So look, one of the most common side effects of testosterone we know is going to be hair loss. Now it only occurs in those with genetic predisposition, but it is one of the most common side effects. So any method of delivery that increases free testosterone will increase DHT and cause hair loss in those susceptible. But men think that a transdermal method raises serum DHT so much higher that it's going to cause much more hair loss. Well, it's really not this increase in serum DHT that's the mechanism that causes hair loss. It's the free testosterone that enters the hair follicle and is converted into DHT, and that will cause hair loss, not the circulating levels. And you got to remember, there's only a limited number of androgen receptors, and once they're fully saturated, any increase in DHT, even intracellular, will have no effect. And so you see men out there that are on injections, one of the most common side effects will be hair loss, even though they don't raise it near as much as the transdermal creams. But what it really comes down to is that if you raise free testosterone levels adequately or the same amount with injections or cream, you're going to have the same amount of hair loss. But what I see is that the cream raises free testosterone levels better for any given total than injections does. All right. And there's a reason why that does occur, and it is related to the DHT. All right. So
So,
when we give so once again, you're going to lose hair whether it's injectable or cream. You will lose more hair in an instance where you're getting a cream versus an injection if the cream raises your free testosterone levels higher than injections and you haven't reached the saturation point with the injections. All right, so there's a time where I can see that occurring. But when you have a good optimal level and you're doing a daily injection or daily cream, that's comparing apples to apples daily. So you have a stable level of free testosterone. If you have an optimal level of free testosterone, injections or cream, and it's the same, you're going to have the same amount of hair loss. But the reason that cream raises free testosterone levels better than the injections is because of the serum DHT that it does create. Even though it doesn't enter the tissue and have any effect, DHT binds sex hormone binding globulin with 5 times greater affinity than testosterone. So whenever you raise that DHT level in the serum, it's going to bind up that sex hormone binding globulin and free up testosterone. That's how it raises free testosterone levels better. So if I get a man with a level of, let's make up a number, 1,200 on injections and 1,200 on cream, the cream always raises free testosterone levels better in that same man.
And just to clarify, so not everybody who takes testosterone is going to lose their hair. You were
No, just
talking
those
about
that
it as
have.
a common, as a potential side effect, but this is there's not a correlation on the more testosterone you take,
No.
the higher your testosterone, the more hair you lose. That does
Right.
not
No,
occur.
you have to have the genetic predisposition. And so I'm sure people out there asking, well, that doesn't make sense, Dr. Nichols, because whenever I take a 5-alpha reductase inhibitor, I take my finasteride, it lowers my DHT in the serum and it prevents my hair loss. It does lower your DHT in the serum. That is correct. But the effectiveness of drugs like finasteride resides at the level of the hair follicle itself. It lowers follicular concentrations of DHT, and it's not the reduction of circulating DHT that decreases the hair loss. And we once again know this because we gave men transdermal DHT, raised their levels to 700 for 2 years, and they had no increase in hair loss or even acne. So that's the key. So the finasteride decreases the conversion of free testosterone DHT at the hair follicle itself.
So what would you
But
say to a patient wanting to take both? Want to be on testosterone, but also take a finasteride?
I warn them, and I give them literature. I always provide them with literature. Okay, there are millions of men obviously on it. It's FDA approved for hair loss and BPH, but I'll always say, look, at your own risk. Anytime you block any of testosterone's active metabolites to serve one purpose, you're going to pay for it somewhere else. And so I advise them that you can do that, but beware of potential sexual side effects that could be long-lasting or permanent. Be careful of some long-term cognitive effects. And I tell them that, look, you have other options, though. There's red light therapy, there's PRP injections, there's hair transplants, there's topical solutions that, don't have such an effect on serum levels. And so, we certainly want to avoid post-finasteride syndrome, but I do think that there is a long-term consequence to anyone that blocks the active metabolites of testosterone, because men out there need to understand that testosterone literally works through its active metabolites. It doesn't work as testosterone everywhere. More than half the benefits come from its active metabolites. And when you block those, you're blocking testosterone's benefits. That's just what happens at the cellular level. So, it's their choice. You can't, as a physician, I try to reluctantly, and luckily most men recently, when you send them the literature, send them the data, they say, no, I'll just use a topical solution or use other things or kind of get used to it.